What is Dr. Jamie DeWitt's research about? Well, here in my laboratory, we ask a lot of questions about environmental contaminants and how they affect the immune system. One of the questions we ask is whether or not environmental contaminants affect the ability of the immune system to do what it's supposed to do to keep us healthy. How did Dr. DeWitt get started or interested in PFAS research? So PFAS stand for per and polyfluoroalkyl substances. They're environmental contaminants. They're a problem here in North Carolina and all around the United States. I actually first got interested in studying PFAS when I was a postdoctoral research associate at the United States Environmental Protection Agency. I was actually kind of dragged into PFAS research. I was doing research on other compounds, and my advisor said, nope, it's time to change. We're going to study PFAS. What made Dr. DeWitt focus her research on Gen X? So Gen X is a type of PFAS. It's been found here in North Carolina, and I decided to do a study on Gen X and its effects on the immune system when I was contacted by a colleague who said, hey, we found Gen X in the Cape Fear River. We don't know anything about its toxicity. We don't know anything about what it might do to humans. Could you help us to understand what it might do to humans? Can Dr. DeWitt share what consumer products PFAS are found in? We're learning more and more about different types of products that contain PFAS in some way. I found out fairly recently from a study done by colleagues with the Silent Spring Institute that some brands of dental floss even contain PFAS. We're probably most familiar with PFAS as they're used to make Teflon or nonstick coatings for cookware, but they're also used to make water repellent coatings on outdoor gear. Can Dr. DeWitt tell us the health effects of PFAS exposure? We have a huge human experiment that took place in Ohio and West Virginia. The drinking water was contaminated with perfluorooctanoic acid, or PFOA, which is a specific type of PFAS. From this huge experiment that was not designed to be an experiment, humans drank this contaminated water. Over 70,000 people were used in an epidemiological study, and the epidemiologists found that their PFOA exposure from drinking water increased their risk of kidney and testicular cancer, thyroid disease, a disease called ulcerative colitis, which affects the intestines, pregnancy-induced hypertension and preeclampsia, and increased diagnosed high cholesterol. This is from this one big epidemiological study. Why does Dr. DeWitt think it's important to continue researching PFAS? Well, PFAS, or per and polyfluoroalkyl substances, is not just one chemical. PFAS is a group of over 5,000 individual chemicals. And we know quite a bit about a very small number of individual PFAS. I use dental floss that contains PFAS. So I want to know, what does the PFAS do to my body? And I'm sure people who are drinking PFAS in their water or eating PFAS in their food or breathing PFAS in their air want to know, what are these chemicals doing to my body and my health? So that's why we need to continue researching PFAS and what they do to our bodies.